With its surface area of 322,462 square kilometers and an estimated population of more than 26 million inhabitants, Ivory Coast's political and administrative capital is Yamoussoukro. The economy, mainly focused on coffee and cocoa production, experienced exceptional growth during the first 2 decades, making Ivory Coast a flagship country in West Africa. While the country is making remarkable economic progress, it needs to make additional social efforts, particularly in the fight against maternal mortality. In this perspective, Ivory Coast benefits from the support of partners such as the UNFPA, the United Nations Population Fund. In 2018, the UN agency strengthened its support to the Ivorian government to help achieve the following 3 transformative outcomes: end preventable maternal death, end unmet need for family planning, and end gender-based violence and harmful practices.
When you look at the country, you see that there are 300 maternity wards. And when you think of the fact that we have about 1 million births each year in the country, that means that in an average, each maternity ward receives more or less than 300 births a year, which is about 1 birth a day. And that means that there is not the required level of specialization of knowledge in each maternity to face complications when they appear. And the idea we have now is to have only 240 maternity wards. These will be maternity wards that will receive an average of 4,000 births a year, which represents much more opportunity for specialization. These will be maternity wards that will be entirely equipped and staffed by qualified personnel. Moreover, there will be a monitoring system, so every 3 months there will be a team that will come and see what's going on and check the quality of care, and will also investigate whenever there's maternal death. It's not because we want to punish people, but it's because we want to understand why there has been a maternal death. So we hope that with this improvement of care services in terms of quality, we will quickly be able to lower the level of maternal death.
In response to this situation, actions undertaken by the UNFPA in 2018 continued during 2019 in collaboration with its government and civil society partners throughout the Ivorian territory. Indeed, although in the West African sub-region, Ivory Coast has one of the better macroeconomic indicators, with an average economic growth of 8% since 2012, the socio-demographic situation remains a cause of concern.
600,000 deaths for 100,000 births. The government is aware of the problem and considers that these indicators are correlated to the economic growth. In Ivory Coast, since 2012, there is growth rate at about 7 to 8%. So such a country should be able to have a performant health system because its resources should enable it to finance the health sector. We need to make sure that the provision of services is accessible to the greatest number, which is at the origin of the universal health coverage. Today, the more disadvantaged can have access to healthcare services. The service provision is available.
Sakassou is a town located 311 kilometers from the city of Abidjan, the economic capital of Ivory Coast. It's a 4-hour drive away on a road that is not very workable on more than 150 kilometers. Once in the city, we start off the day with a visit to the maternity ward, which welcomes an average of 5 to 10 women a day from different localities. The challenges we face for prenatal consultations is that women don't come early to the hospital for their consultation. They come when their belly is big, which is at the 2nd or 3rd trimester. They won't come at the first trimester. Not many women come in the first pregnancy trimester. I have given birth to several children here, and for each time it's been the same service. Each time I come, they really take care of me. There has not been any problem so far. A few kilometers from Sakasu's maternity hospital, there is a husband school, an initiative working for a stronger involvement of men in the promotion of reproductive health. It also aims to promote behavior change at community level. These role model husbands are expected to seek solutions for their wives' problems.
Par le passé, les communautés ignorent beaucoup ce que c'est que.
In the past, the community ignored what health was about. So we have approached them. Since we are in the community, we live in our community. We explain to them what health is, especially what maternal health is. Because we have noticed that many die at childbirth. Many who are pregnant don't do the PNC, the prenatal consultation. So we try to explain the reason for all these factors.
Nous avons constaté qu'il y a 8% des consultants.
We have noticed that 8% of the population who come for a consultation comes to the health center from the 27 villages where the activity has been carried out. And then for the prenatal consultation, we have noticed an increase of 13% for the pregnant women for these villages who have come for a consultation in this healthcare center between 2020 and 2019. Then these pregnant women give birth. We have had increase at 12% for assisted birth for these women who come from the 17 villages who come to give birth in these health centers. And for the fight against HIV for the PMTCT, the prevention of mother-to-child transmission, there has been an outstanding increase thanks to the activities of Mary's Côte. 35% of the persons have participated in the screening to know their HIV status.
Des personnes ont participé à leur dépistage pour connaître leur statut de VIH.
The World Health Organization, WHO, estimates that there are about 2 to 3.5 million women with obstetric fistulas in developing countries, with 50,000 to 100,000 new cases occurring each year. Ivory Coast is not immune to this scourge, especially since women's health has deteriorated significantly and is a major concern. Alongside the UNFPA, the Korean corporation, KOICA, has been funding the fight against obstetric fistulas in the country since 2012.
And we are cooperating with Ministry of Health, Ivorian government, and UNFPA for implementing this project. We actually start this project from the very beginning in 2010, and we successfully implement the first and second phase with UNFPA and the Ministry of Health. We are investing around $8 million. We are investing $8 million by now, and we are planning to invest $8 million more from next year. By now, the project has been really successful because the full treatment rate, the full recovery rate is way exceed the WHO recommendation. And also, in addition to that, it actually changed behaviors and also awareness or the mindset of the people in here, especially the Ministry of Health. They embedded the fistula strategy in their national health plan from 2016 to 2020, and also they providing the FFS, the fee for services when doctors do the surgeries for the fistula, and also the community peoples. They the fathers or the parents. They actually recommend women to go and take the regular checks to prevent the fistula, and even the village imams. They also recommend and tell people that it's not the curse, but just a simple disease that can be cured. And with all this overwhelming encouraging and impressed outcomes, we do hope that we can go further on. And because we are now preparing for the third phase from next year, we are thinking to focus on prevention activities more because by now around 8,000 cases have been reported in Côte d'Ivoire, and only treatments couldn't resolve this problem. So we are thinking to focus on the prevention activities like the community awareness raisings or the family plannings, those kind of, we are thinking to invest more. And also, in addition to that, we would like to share this outcome with all neighboring countries. I heard that not only Ivorian people, but also the neighboring countries, women from Niger, Burkina, Liberia, and also Chad, they come and got the treatment to our project's clinics, which is in 8 districts all over the Côte d'Ivoire. So maybe for the third phase, we would like to put more emphasis on the communication and the promotions to share this outcome with neighboring West African countries.
Every day, more than 16 women die from complications related to pregnancy or childbirth in Ivory Coast, most often due to medical problems that can be prevented or treated. Fistulas are a consequence of poverty, poor access to quality maternal health services, and gender discrimination. Blandine, a 30-year-old job-seeking student, is a fistula survivor. She lived with the disease for 3 years before undergoing surgery in 2013. After the operation, she was able to remarry and have a daughter who is now 9 months old.
Pendant la grossesse, quand je suis tombée enceinte, je partais pas régulièrement au centre de santé.
During pregnancy, I didn't go regularly to the health center. It was difficult to get there, so I didn't go. In fact, the day I gave birth, I left it to the last minute to go to the health center. I was in an exam room, and that provoked, well, according to the doctor's explanation, that is what provoked the fistula. When I gave birth, I didn't feel it when I gave birth. It was some time after I felt that I had that illness in me. So for 1 year, I was living with this illness, not really knowing whether it was an illness or not. It was thanks to a radio show, Onusi, that I understood that I had an illness and that I could get treated in hospital. It was my mother who encouraged me. I went to a health center and I had the surgery there. In my surrounding, my mother supported me. As my parents are Muslim, especially on my dad's side, it was difficult at home. I wasn't allowed to cook, for example, because it is not really appropriate in the Muslim religion, which means that I was always isolated. I was no longer part of the group of women in the kitchen. And at school as well, I could no longer go to school. Blandine is now cured, but she has a bad memory of this period. Indeed, she was abandoned by her husband at the time. And 4 years after the birth, she lost her child who was suffering from severe anemia. After my child's death, 4 years after, I returned to my life again because I got operated in 2013. And thank God I met another man with whom I have rebuilt my life. And as we are now, everything is well at home. I also had another girl by cesarean because I could no longer give birth by vaginal delivery. It was complicated. I gave birth by cesarean so that I wouldn't have to face the same illness again. And today I live well, and with my husband and daughter, everything is well. There are no worries.
We need to give them support and help them because they need it. We should not abandon them just because they are ill. We need to support them. I think that it's not an illness that is incurable. They can get treated, and we need to support them.
The UNFPA continues to advocate at the government level for the adoption of a law on reproductive health and for funding for the purchase of contraceptives. Similarly, efforts are being made to improve the contraceptive supply chain, to strengthen the supply of family planning services in both fixed and advanced strategies, to expand the community-based distribution strategy for contraceptive products, and to mobilize communities to use family planning. From Sakassou, we went to Guiglo, 373 kilometers away. A 7-hour drive, and here we are. Just as we arrived, we witnessed an emergency caesarean section at the city hospital. Zainab is only 20 years old. She never went for a consultation during her entire pregnancy. This has resulted in a fetal-pelvic disproportion, commonly referred to as FPD.
This is a patient that lives in the village of Brultere. She entered labor. She came from the general hospital to Brultere, and from there the delivery was difficult. So that is why she was referred to us. And when she arrived here, we saw that she absolutely needed a caesarean, and that is what I just did now. It went well, thanks to God. The child was saved and the mother too. She had what we call a fetal pelvic disproportion, or FPD. It means that the head of the baby was stuck and it couldn't pass the mother's pelvis. That is why we did the caesarean. It was in 2014 that the UNFPA gave us this ward that is a support through the delivery room, so we have no problems. As soon as we have a case of caesarean in the delivery room, we make our way directly to this ward for the surgery. It's really fast. If we want to talk about maternal mortality in the Cavalier zone, we need to go deeper into the root causes. We observed that in the context of the different crises that we faced and the violence that followed, women paid a heavy price. It is in the sense that the UNFPA has intervened powerfully by equipping our health structures with material equipment and also by strengthening the skills of the personnel and enable them to better reception the women who come here.
The community-based distribution agents, or ADBCs, of Bedi-Goazon, 35 kilometers from Guiglo, are not to be outdone in the fight against maternal and child mortality in Ivory Coast. Their mission is to mobilize communities to change social norms for reproductive health and to promote family planning.
The working method is like this. The big bosses give us medications, I mean by that contraceptive methods like the pill, etc. Then we pass on the pills to those who wish to have them. We refer these persons to the health center to carry out the different tests. In terms of the problems that we face, there is the state of the roads, because you can meet a person or a woman and explain to her the importance of giving birth in the health center, but unfortunately, if the birth happens at night, it will be difficult for her to go, especially considering the fact it takes a long time to even decide whether they should go or not. Very often, it's the husband who makes the decision. There is also the fact that the husband is very often unaware of the signs of pregnancy. He may not know what there are. All this means that we have big challenges.
The Women's Friend Space plays the same role. Its mission is focused on changing people's behavior in order to encourage them to space birth and to seek advice during pregnancy. We carry out ground sensitizing activities. We go to the houses and homes to sensitize women on the importance of family planning, the importance of prenatal consultations, and also on the importance of using the health center for giving birth. And we sensitize on coming early so as not to find yourself in a situation where you are almost out of strength before even reaching the health center. Not only do we have the focus groups and the home sensitizing activity, but we also do mass sensitizing, because when we come here, we can have around 100 women in our space who we speak to. The UNFPA is committed to intensifying its advocacy and national capacity building efforts to design and implement a school and a community sexual education program for Ivorian adolescents and youth. It's within this framework that a course on comprehensive sexuality education is offered at the Technical High School in Abidjan. The UNFPA's Deputy Executive Director has visited the country to discuss the importance of this course on reproductive health.
The education on healthy life, healthy behavior, particularly with sexual health, is very important for young people, for them to be informed of about what it means to have sex before age of 18, and for them to decide with whom to have sex, whom to marry in the future, and in the long term this is a life skill. This life skills helps them when they are adults and also when they are grandparents. It's a life education. Many young people who do not have that knowledge and information, they end up being pregnant, and that has impact on their emotional and physical health, and even some of them attempt to abort, and they end up in unsafe abortion, and they either die and get sick. We try to reduce preventable maternal deaths in many ways. First of all, pregnancy and live births need skilled attendants. Midwives play very, very important. We support Côte d'Ivoire and the key stakeholders in the health sector to have the workforce, particularly midwives, a large number, not only in big cities but also in rural areas. That is one important. The other is, as part of the universal health coverage and primary health care, we want to work and we are working with various stakeholders to strengthen the health system. And women, when they get pregnant, they need that care during the pregnancy and also at birth, and when it's complicated, emergency obstetric care and newborn care is very, very important. So strengthening that is another work. So overall, our intention is to reduce maternal mortality through multi-stakeholder efforts, United Nations, government, civil society, to ensure that women get the necessary healthy care support during pregnancy.
Thus, the combination of actions to strengthen comprehensive sexuality education in schools and communities and sexual and reproductive health services for adolescents and young people in health facilities and during mobile campaigns will contribute to maintain youth in good health and help them unleash their full potential. Today, in general, the state is much more committed when it comes to getting involved in girls' and women's access to family planning for the reduction of maternal mortality in Ivory Coast. And there is clear progress, even though we haven't yet reached a full level of satisfaction. We work on two pillars. First of all, there is the advocacy work, which consists in working with the political decision makers in view of improving the legal framework. In Ivory Coast, for example, we haven't yet got any laws related to reproductive health, and the network of young ambassadors works with other partners of the civil society who are older, adults, the coalition of organizations of the civil society, for example, for the proposal of family planning, and with other coalitions on a national level who work on improving that framework, that is, to introduce a law on reproductive health. On the other hand, we do communication activities for adolescents and youths to give them the information related to family planning. Where do you find the services? What are the services that are available in Ivory Coast? To combat this social scourge, namely maternal mortality, the need for training human resources, such as the care workers who accompany the nurses, midwives and technicians, is important. The INFAS, the National Training Institute for Health Workers, trains most of Côte d'Ivoire's health workers and thus contributes to the fight against maternal and infant and child mortality. The school is one of the centers of excellence of the UNFPA and West African Health Organization program.
Nous sommes une école de formation et donc
We are a training school, and so we train students in providing good care for the population. We give them all the skills necessary to enable them to care for the population in terms of health in particular for the mother and child. And the training is done in modules. There are several modules according to the different levels. For example, for the midwives, according to their field of specialization, there will be more content. For midwives, there's more training in gynecology, obstetrics, pediatrics, family planning, for which the modules are more important. Those training to become nurses will have training in medicine practice, public health, surgery, and through larger modules. But in all cases, they receive the same teaching, which will enable them to, no matter where they are, care for the population well. So we give our best to offer quality training for these health agents. So this is our way to contribute to reducing maternal and child mortality. The development of training programs to produce multidisciplinary teams is an urgent and essential necessity. Increasing the number of staff by improving the quality and adequacy of health workers to meet patients' needs contributes to improving the health of the population. Before I became a health agent, I had prejudices against, first of all, my own current job, midwifery. But with the experience from the work practice, from the training, I can see that it's a noble job and it's rewarding. It has touched me a lot. I will put into practice what I have been taught in school. I will try and reduce the bad practice that exists outside. When I talk about bad practices, I mean first of all the poor level of asepsis. It contributes to mortality as it is linked to infections. There is also the lack of experience of new practices that control postpartum hemorrhages. That is really what we fight for as midwives in the delivery room. The results obtained thanks to the interventions in Ivory Coast are rather favorable. Indeed, some 1,900 deaths have been prevented through improved obstetric care. The proportion of women who gave birth with skilled health personnel increased by more than 73% in 2016. In addition, 614,000 people have adopted a family planning method to space births. 440,000 unwanted pregnancies and 157,000 abortions have been prevented. 329 women with fistulas have been operated free of charge with a success rate of 77%. And finally, there is a 34% reduction of pregnancies among schoolgirls.